I started off as a physiotherapist here in Sheffield and moved through into specialist into neurology, and then got very interested in the background of what I was doing and trying to understand exactly what was happening when I was treating people, understand whether it was the theory behind what I was doing. So I actually started an MSc. And I did an MSc, and when I completed that I came into Sheffield Hallam. So I've worked mainly in neurology and also out in the community with patients. It's being with the students really. I mean, obviously with a part-time and distance learning route, I'm obviously interacting with students a lot online. And I really enjoy hearing about their clinical practice and the sort of issues that are coming up for them in terms of their clinical practice. And I really enjoy working with students through those issues, trying to help them to understand how they can resolve some of those issues and improve their clinical practice. And just watching students develop and learn is great. Anybody out there, physiotherapist out there, who is applying treatment but maybe not entirely sure why that treatment might work, or would like more theoretical understanding behind what they're doing and would like to clinically reason in more depth, perhaps understand the evidence behind what they're doing. That's what the course is all about. It's about developing in-depth clinical reasoning and allow students to be able to be self-directed learners out there in clinical practice, making the right decisions to give the best result for their patients. With the DL distance learning course, there'll be lots of online facilities in terms of library facilities, lots of online access to journals and texts. There are all sorts of online materials around those topics to really help clinicians not just develop their knowledge in physiotherapy in more depth, but also to develop themselves as an academic and develop themselves professionally. I am quite an active researcher myself. I've enjoyed research virtually throughout the time I've been at Sheffield Hallam, and I think my research specifically is looking at spasticity in multiple sclerosis, and I've been investigating the sort of patient-orientated perception of spasticity. So I've done qualitative research interviews looking at patients' perspectives of living with spasticity and what out of their spasticity experience is important to them.